This lesson is going to be a quick overview of the nursing process. We're going to do a lesson on each element of the nursing process, but this one's really just kind of a quick overview to give you an idea of what is going on. So the nursing process is a way to provide care for our patients, and really a good way to think of it is kind of a modified scientific method. We all remember the scientific method from back in elementary school and stuff. The nursing process is really kind of a modified scientific method. It's really kind of a method to consistently and uniformly provide care to our patients. No matter how many patients you have, no matter how many shifts you work, no matter where you work, this is a way that we can provide care to our patients that's uniform and consistent. So what is the nursing process? Now, again, you might see AAPIE or APIE, but we're going to talk about add pie. Add pie. Just pretend like you got a big piece of pie and we want to add pie to it, okay? So the first part is assess. With assess, what we're doing here is we're collecting data, all right? We're collecting objective and subjective data. Remember, we're going to talk about each element of the nursing process in individual lessons, so make sure you check out those lessons. But with assessing, we're collecting data. This is our time to look at everything, to find all the information that we can. We're like little detectives right here. We're looking for objective and subjective data. During the diagnosis phase, realize this is not a medical diagnosis. We're not giving a diagnosis of meningitis or something like that. This is not a medical diagnosis. Basically, this is what we suspect is going on with the patient. And in this phase, we're also anticipating what care might be given to the patient. Then during the planning phase, this is what you plan to do for your patient. What will you do? What are you going to do? You've collected all your data. You've said what you think is going to happen. So what are you going to do for the patient? Then during the implementation phase, you do it. You've got your plan all together. Now in implementation, you do it. Go do something. Then during the evaluation phase, did it work? Did you get all the data you needed? Did you make the right diagnosis here? Was your plan accurate? And did you do the right thing? Okay. Now, this is a cyclical process. Then you go back up here to assess again. Diagnose, plan, implement, evaluate. Did it work? Then you go back and do it again. All right. This is something that's going to happen over and over again. We also talk about this in our test taking course. I would recommend you go in there and watch those videos because we talk about how to answer questions on the nursing process. But here we're going to talk about how to use it in your practice as a nurse. So then we got to prioritize. With prioritization in nursing, we're really trying to gather data as quickly as we can, get as much data as we can as quickly as possible. We're trying to determine the needs of our patients. Now, there's two different pieces with this. We want to determine the needs of individual patients. So what are the needs of my patient in room 301? What are their needs? Okay. And then we can use Maslow's hierarchy of needs, and we can say, here's their needs. They got, 2 physiological needs. They got 1 safety need. And we start to focus and prioritize our care that way. Then we also look at the needs between our multiple patients. So if I have 5 patients and in bed 1, they got a safety need. All right. So bed 1's got a safety need, but bed 3 has a physiological need. Their airway is compromised. So I'm looking at my needs with my individual patient, them alone, but then I'm looking at my needs with all of my patients. I'd really recommend you go check out the prioritization lesson in the fundamentals course. I think that'll help you dive in a little bit more there. We go into that a bit more. So critical thinking, what is critical thinking? And again, we have a whole lesson on critical thinking in module 5 of fundamentals. So make sure you check out the critical thinking lesson, but I'm going to give you a quick overview of critical thinking. With critical thinking, we're recognizing problems as quickly as possible. We're gathering all of our information as efficiently as we can. We evaluate all possible outcomes and all possible solutions. So outcomes and solutions. And then we implement care with the best possible outcomes in mind. Once we recognize the problem, we gather information, we evaluate possible solutions, we implement with the best possible outcomes in mind. Again, make sure you check out the lesson on critical thinking. A big part of the nursing process is learning to think like a nurse. The nursing process in totality is thinking like a nurse, realizing this is a complex process and that it's very cyclical. All right. We have a whole lesson here on thinking like a nurse. I'd really check that out, where we go into what you should kind of see when you walk into a patient's room, what your day should look like, how you should understand the process of being a nurse and working as a nurse. So this is a complex process. ADPI is the framework to think in: assess, diagnose, plan, implement, evaluate. We'll go over each of these pieces individually. And then you got to prioritize your care, and you have to think very critically. Always remember that this is a very cyclical process. As you work through this process, you're going to go back around and start over. It doesn't end. You don't go in, do the nursing process, and then you're done with your shift. It continues to repeat. It's a cyclical process, and it's very fluid as you're going. So some nursing concepts to think about here are professionalism. This is part of our professional work. And then clinical judgment. This is the way we can think and judge in a clinical setting. So key points are: gather data. Make sure you're gathering all the data you can. Make sure you're gathering as quickly as you can. You'll quickly gather data through ADPI: assess, diagnose, plan, implement, and evaluate. Realize this is a multi-layered process. You got your nursing process, you got critical thinking, and then you're trying to think like a nurse and realizing this is a cyclical. This is something that's going to continue to repeat. It's a developed process with time. Realize that critical thinking doesn't have to happen today. As you begin to work on the floor, as you begin to have experience with different patients, critical thinking will develop as you go and as you use these frameworks. And then realize that this is all part of kind of thinking like a nurse. The culmination of all these different things of ADPI, of critical thinking, really play into thinking like a nurse. And don't be too hard on yourselves. Realize this is something that will grow with you and that you'll grow into. And these are kind of frameworks to help you develop those skills. All right, guys, I hope that helps. I hope that kind of gives you a quick overview. Again, we're going to dive into each of these individually, but make sure you check out all the resources, all the other lessons that will help you kind of get each of these topics in more depth. All right, now go out and be your best selves today. Happy nursing.